For the Unit 5 project, I chose to address a public complaint by a patient claiming negligent patient care. A phone call was received on July 8th from the patient, who we will name Mary, briefly stating that she was involved in a car accident on July 4th and received nothing but bad treatment from our organization and is contemplating filing charges. I requested Mary allow us to sit down with her in person so we could obtain a full story regarding the incident, as we are certainly concerned with any allegations of mistreatment. The Director Chief was contacted and briefed on the initial complaint. It was agreed upon that the next best plan of action would be to have a video recorded meeting as soon as possible with Mary, along with the HR representative and 2 supervisors. A meeting was scheduled the next morning with Mary, whom agreed to meet at EMS headquarters. During the video interview, Mary reported that after being involved in an accident, she obtained a femur fracture and a concussion, amongst other minor cuts and bruises. She stated that it took the fire department forever to arrive after calling 911, and once they did, it took them even longer to get her out of the car. She stated that during the whole incident, she suffered from extreme pain due to a broken femur. She states that once she was finally removed from the car, the ambulance crew, without much dialogue, immediately raced to the hospital that she did not request. She reported specifically requesting the hospital right around the corner and begged for pain medication. However, neither of her requests were fulfilled. At the end of the interview, it was evident that Mary was extremely emotionally charged. All parties present expressed their compassion for the incident and guaranteed that a full investigation is underway. She was informed that she would be contacted within the work week after the investigation is complete. After meeting, information such as patient care report, dispatch information, fire report, and police reports were all obtained for review. It was found that rescue equipment arrived within 3 minutes and the ambulance within 5 after the 911 call was received. Fire reports from the rescue operations report that the vehicle had rolled over, incurring heavy damage and landing on its roof. It reported taking 12 minutes to extract the patient while using multiple hydraulic tools. The EMS crew was notified while on standby during the extrication that the patient appeared critical and had a femur fracture. EMS crew PCR report showed they're pre-planned to transport to a local 1 facility due to the injuries. EMS reports carefully placing the patient on a long spine board and quickly moving her to the ambulance. They report that EMS crews report that this was considered a load and go scenario, so 2 firefighters were recruited to accompany during the transport. Vital signs revealed extreme hypotension and tachycardia. Physical exam revealed active bleeding from an open femur fracture. During transport, the patient received IV fluid bolus, EKG monitoring, and wound care. The report also notes that pain medication was considered but withheld due to protocol and contraindication in hypotensive patients. They note having lengthy conversations with the patient explaining the transport destination and their inability to provide pain relief. It was noted that crews suspected a concussion due to repetitive questioning. Further review of the report noted crews followed all appropriate organizational protocols established by the medical director and universally encouraged in EMS treatment. The medical director was informed of the complaint, given a copy of the PCR, and informed of our findings. The director ultimately agreed that the crew performed exceptionally and there were no signs of negligence. The EMS and fire crews were contacted and all stories matched the documentation on previous medical documents. It was determined that the next best course of action would be to contact Mary and schedule an additional in-person meeting, to which she agreed. Given the extent of the allegations, the medical director was requested to accompany staff with the next meeting. During the first part of the meeting, Mary was informed of the details of our full investigation. She was informed of the timeframes involved in response, which are quicker than national standards. She was informed about the complication of gaining access to her due to extreme damage and location of her vehicle. The medical director informed Mary about the extent of her injuries and how a level 1 trauma center is able to appropriately treat her condition only. The medical director also informed Mary about how pain medications are contraindicated and, if given, could result in furthering her hypotension or even death. The medical director lastly expressed how having a concussion can alter her ability to properly understand the entire scope of the circumstances involved. In addition, in the end, Mary was susceptible to the information provided and stated she had no previous medical training and therefore was guilty of assuming the worst-case scenario. She ultimately thanked the organization for joining her to investigate the incident and denied any further consideration for pursuing legal action.